Good to go, Rachel? We got? Hello and welcome to the July 29th, 2025 Health and Ed Committee. Hope you've all had a good summer thus far. It's been a little bit relaxing to have a few less meetings this last 6 or 8 weeks. So welcome back. Rachel, if you would call the roll, please.
Commissioner Oliver.
I have to wait my 5 seconds. Present.
Commissioner Davidson.
Here.
Commissioner Wilson. Here. Commissioner Boyd.
Here.
Commissioner McMurray.
Here.
Commissioner Gooch.
Present.
Chairman Dodd.
Here.
We have a quorum.
So I just noticed Commissioner Oliver, is there a 5-second delay? Okay, glad to get that lesson. I was absent last Thursday, so. Do we have any public comments tonight? All right. So we will move on with the meeting, and our first item is to consider the minutes. Mr. Wilson.
Thank you, Chairman. I have reviewed the minutes from our last meeting. I find them to be in order.
Second.
All in favor say aye. Aye. Any opposition? Motion passes. Thank you. Next item, if y'all recall, we met Ms. Sydney Butterfield, 2 months ago at the full commission meeting, and this will be the first opportunity the new director of health department has had to speak to the committee. So welcome, Ms. Butterfield. Yes, ma'am. Come to the mic. And I've got you turned on.
Okay. Hi, everyone. It's good to see you all again. I believe on your iPads you should have our monthly report from June 2025. The health department has continued to work hard to promote, improve, protect all the lives of Tennesseans, and we continue to do good work as the summer wraps up and as we get into the back to school season. So we're ready to help get all the kids back into school with their vaccines up to date and everything. So if you all have any questions about the report, I'm happy to answer them. And if not, I'll jump right into our new budget contract.
I'll make a motion to approve.
Motion is second to approve the report. Any questions or discussion? All those in favor say aye. Aye. Any opposed? Thank you.
And then do I need to talk about the contract?
Yeah. Yes, ma'am.
And then my second item for you all is our fiscal year 2026 local health services grant. This is a contract between the county and the state of Tennessee Department of Health. It is fully reimbursed by the state and it covers 47 positions, 44 of them which are filled currently, and it covers the salary, benefits, travel, and our interpretation service that we use at the health department. It's the same as years past. So the process and everything is the same there. Any questions that I can answer for you all?
Question.
Yes,
What positions are available? You said all 47 or not?
We are not currently trying to fill the 3 that are vacant. There's one interpreter position, a clerical, and a nursing aide, I believe. Off the top of my head, I think that's correct.
And you're not trying to fill it?
No, we have
reason?
other staffing positions to fill that right now. So based off of our need, we don't think that it's necessary at this point, but we're monitoring that constantly with our patient flow.
So relative to the grant, when you accepted the grant or applied for the grant, did you have to identify it was going to be 47? Is that a requirement? Will that be a problem? I guess is the question, if you don't fill all 47 with the grant funds.
That's not a problem at all. And this isn't your typical grant that we applied for. It's a partnership with the state and the county to help support the local health department. So we don't have to apply for the grant every year. It's a renewed contract agreement between the county and the state.
And it's no problem
No.
with it? Okay, great. Thank you. Motion to approve.
A motion and a second. We have a question from Commissioner Phillips and then followed up by Commissioner Gooch.
Just the amount, Sydney, is it the same as it was last year, or is it
It is 8,000 more than the final amended contract from last year, but I do expect that there will be an amendment once this is fully executed to account for the county raises that were given at the beginning of this year. So I'll be back up here in a couple of months to get that amended contract passed.
Commissioner Gooch.
Yes, Ms. Butterfield, is this the whole budget, the whole of the budget?
No, this is just our local health services grant. This is just one part of our budget. We have direct local funds from the county, and then also we have state budget as well.
Okay, so health services, and it also includes the department in Smyrna?
Yes. Yes.
If there are no further questions, we will have a roll call vote.
Commissioner Oliver,
Aye.
Commissioner Davidson, Commissioner Wilson,
Yes.
Commissioner Boyd,
Yes.
Commissioner McMurray,
Yes.
Commissioner Gooch,
Aye.
Chairman Dodd.
Yes.
Motion passes.
Thank you.
All right, thank you all.
Thanks, Ms. Butterfield. Next on the agenda, just I would direct your attention to the minutes of the CCRC if you had any questions about that. And the next item is a update from the schools. No budget amendments tonight, but
Excuse me,
yes,
Mr. Chairman, I did have some questions
yes. Hang on just a second.
relative to CCR&C.
Yes, by all means, please.
Could you clarify for me our responsibility as it relates to them? So we have it's just the building, is that correct?
Correct. We're the landlord.
Just the building?
Correct.
So no service. And the reason why I'm asking is because with the impending Medicaid, Medicare cuts, things of that nature that will impact those residents, I'm just wondering if any of that financial responsibility will fall on us.
No, it's a board. The charter sets them up. It's a board-driven, board-directed. We have a contract on the building.
Okay.
We have
So it's
a
just the
unique
building.
component that the mayor is the chairman of the board.
Mm-hmm.
The charter had that, but there's no financial responsibility.
All right, thank you.
You're welcome. Any other comments about community care? Mr. Wilson?
Thank you, Chairman. I believe we had a conversation previously that when we got around committee selection time in September, did we agree that we would see if a representative from this committee was willing to attend or be on the CCRC so that they could report? I think we talked about that.
And just tonight, I spoke to Chairman Phillips about the timing of that. So we wanted some clarity on when that role moves, because I think I'll speak for myself, I would love for someone from this committee to be the representative. And I think we have a couple of great people who would volunteer to do so. So I don't know if we want to get into, Chairman, if anyone knows the process. Otherwise, I was going to research and have it for us next month. We have steering in the full commission this month. The following month is committee. So I was looking forward to the September meeting where we would clarify that. But I see you pointing at Rachel.
Normally, when you do the committee selections, that person is kind of dual. If you can select one of you to be on CCRC. In the past, it was Commissioner Carol Cook, and she would be able to report on things. Of course, she also went to that CCRC meeting. So if one of you who select Health and Ed, if this were the same group next year, they might just need to specify that they're going to go to Health and Ed, or you guys can vote on that.
Okay.
It was just always assumed that she went, so.
Right. And then I think Mr. Johnson was on this committee and changed committees, but was already on the
Right.
CCRC board as a rep. So we deviated from that practice.
Have we sent it, do you remember, Rachel, to steering, then to the full commission to put that as a policy or a rule that the commission representative would serve on public?
I don't think there's a
Health and Ed.
specific, it's just been done. I don't think there's a specific sentence that
But it
states
hasn't been done
that.
for the last, I don't know how.
But this time when Paul Johnson went to the CCRC board, of course, he did not select to be on Health and Ed, or one of the commissioners to be on Health and Ed. So
Is that appointment renewed every year?
That's what Commissioner Phillips
CCRC?
and I were.
No,
The commission representative?
it's coterminous. It goes with your term. So whoever will be on it for the next 4 years when we,
So that's why I was clear. I was going to make sure with Chairman Phillips, we were going to make sure that there's some gray area there on if Mr. Johnson's term is up when we have committee selections, or if there's another component to his term. That's the only part.
no, he would still be on it unless, until 26.
You're correct.
Yeah.
So that.
His is coterminous. Yeah.
We may not have an opportunity.
So if we were to go that route, and I think that we should, it won't be until after the next election.
Correct.
That may be the tradition. It's not policy.
Unless he chooses to give up that selection on that board.
Well, can we go ahead and have steering look at that? And if I need to make a motion to send it to steering to have a policy or a rule or whatever you want to call it, that the commission appointment to the CCR board is a member of Health and Ed.
I would like you to make the motion so it hits the minutes and then give us a conversation likewise hit the
I'm
minutes.
going to make that in the form of a motion. Also, for steering to look at that, if that member were to leave Health and Ed, that they will forfeit their representation on the community board in a new appointment.
So, and I would consider that as one amendment, as not an amendment, but one motion.
One motion for them to
Okay.
look at that. So in other words, if one of us is chosen and then we go off of Health and Ed, then we would have to forfeit that appointment for someone else.
Before I entertain a second, we would consider a policy stating that Health and Ed, that the representative on CCRC be a Health and Ed member, and if they leave Health and Ed, new selection would be done. So do we need to consider in this motion or in the discussion afterwards, do we deviate from the current policy or tradition that this position stay intact till the end of the co-term? Or do we need to handle this motion first and then discuss that?
I think you're getting into a gray area with
Okay.
the CCRC bylaws, and we'd have to look at their committee process as well, because they're kind of together, but they're not. But it's always been whoever is the representative has been coterminous, and I see if for this next year when we reelect, will one of you all be on there instead of Paul Johnson? That's something
Well,
I
steering
do
can
not
look at
need
all of
Nick.
that.
for
I think the motion stands.
Yeah.
And
Yeah.
it's just a matter of my part muddied it. So I'm good with your motion if there's a second, or if we need to restate the motion. A second. And so any further discussion? I think we're clear on the motion. When you have the motion clear, Rachel, we'll.
Just that the CCRC representative must be a member of the Health and Ed board.
And I think we need to state in there if
Yes,
that
and
member ceases
they
to
come
be on
off
Health
of
and
Health and
Ed,
Ed.
they forfeit as part of the same motion. We're not touching the length of term now. That's a question I think for steering and our chairman of the commission and myself.
So if he ceases to be on Health and Ed, he would forfeit his CCRC appointment, he or she.
Yes.
And we'll get into the policy of, I would assume, then Health and Ed would reappoint, according to the, so I think we're good on this part of it. All those in favor say aye. Aye. Any opposed? Motion carries. Thank you for that unexpected dialogue. Very good timing. Thank you, Commissioner, all of y'all for
Mr. Chairman,
bringing that back up. Yes.
it's
Mr.
okay with
Phillips.
everyone. I'll get with Nick Christensen to get him to put that in the form of a motion. In addition
Thank you. And if Rachel's correct, and please have Nick consult Evan Cope, the attorney of record for CCRC. Just to
Because-
make sure they dialogue in that.
Evan Cope is CCRC's attorney, and we consult with him on those matters. They're completely different.
Nick is usually pretty good at doing that.
Yeah.
We'll make sure of that.
Yes, thank you.
And it'll be presented next Monday at the steering committee meeting, okay?
Thank you, Chairman. Thank you all. Next, Dr. Sullivan, a general update as your board got back to meeting last week, I believe.
Hello, Commissioners. Just a couple quick updates. We are right in the beginning, of course, of starting school. Our principals came back a couple weeks ago. Assistant principals last week. We had our new teacher beginning of the year training and meeting today at Life Point in Smyrna, so we appreciate them hosting us. And then today, sorry, coughing, on August 1st, our teachers return. So all 3,800 teachers will return on August 1st. And then students, August 6th is their 2-hour day, full days August 8th. So everything is just in preparation for kids to get here. And until they show up, we don't know how many we have. So, but somewhere well over 52,000, I am pretty sure of, as we've stayed pretty consistent there. Couple other updates. So we have all of our weapons detection system units in. We will have a strategic rollout over the next couple weeks with target of making sure everything's operational after Labor Day. So that is intentional so that we can start the school year with students with a strong environment, making sure that students are registered, parents feel welcome, and then doing messaging around this is what it looks like when you come to school. This is what students will be walking through. If you're a parent, this is what you'll be walking through as you come in. Same thing for athletic events. We will have them at varsity football and basketball events once we are fully operational. And then middle school JV basketball and JV football. And I know that may seem strange. Why didn't you do JV as well for high school? JV middle school is on a different day. And so, or varsity football and JV football are on different days for your high school. Middle school, they just play right beforehand. So that's why we have that distinction. Couple other quick things. We have 2 ribbon cuttings. First is August 1st at 6 o'clock. That is Poplar Hill, so that is Friday. And then August 13th is 5:30 on Wednesday. Realized that we had a county commission meeting for our first email, and so wanted to make sure everybody had the opportunity to attend. So it's August 13th at 5:30, not August 14th. So August 13th at 5:30. And then this Friday one is at 6 o'clock.
You mentioned the school in Laverne, please. I don't think you
Yes,
mentioned
I'm in
it.
Springs Community School, sorry. So it is a school. It's been operational, was Laverne Primary, then Roy Waldron Annex, and it's Simon Springs Community School. And the community should be very proud of that school. We're very proud of the work we are doing with the commission's help in making sure that we are renovating some of our older schools, because it definitely needed some work. And it looks like a traditional Rutherford County school like you would expect now. And then other than that, it is just all hands on deck getting the school year going. And so we are prepared for everything that we know at this moment. So the beginning of the school year always throws challenges that you don't know exist until they're there. Yes, absolutely. And then federal funding was restored, so we had moved quite a bit of things around because of the federal funding freeze. Federal funding was restored. We got our official notice yesterday morning. So only thing that was not restored, and this is a Tennessee Department of Education, not federal, was our McKinney-Vento funding for homeless students.
What was that one?
McKinney-Vento funding for our homeless students. So the Department of Education this year made that a competitive grant. I don't know why that is, why homelessness is competitive across the state, but lots of districts either lost funding or did not receive it. We weren't aware it was a competitive grant, and so we will not receive it this year, next year, or the following year. So we've reached out to, and a lot of directors have reached out to state legislators that this was just a Department of Education decision that definitely feels like it is harming some of our most at-risk students. So that's where we are.
What does that mean for those students?
Nothing, because we still have the federal law to provide the same services. We were receiving about $225,000 roughly, and so that funding just won't come from the department. It got reallocated to other districts.
But it will be supported by the federal funds, though? I misunderstood.
It won't be supported by any federal funds.
So those,
We absorbed that, that funding supported one position, and so we basically decreased the central office position we had by retirement and transferred that person, her name is Jessica Johnson, who works with homeless students, and she's amazing. And we transferred her into a student support role that we had open from retirement. So it worked out. So the other parts that we'll still have to fund that are, we don't receive funding for, transportation, food, those different types of things.
And how are you planning on funding that?
With our operations budget that we already have. So luckily it's, I hate to say it's only about $100,000, $150,000 that we have to come up with, and in a budget as big as ours, we should be able to absorb that.
Okay. So the students won't lose services?
No. No, so we still have the federal law to follow it.
It's a shame how they criminalize
It is.
homelessness.
Yep.
I did have some questions relative to your update that you gave with security.
Yep.
How many entrances will be monitored? For example, I know several of the high schools or larger campuses have multiple
Yep.
entrances where students or whoever can enter.
Each school will be different. So each school's entrances, the ones that where our weapons detection systems are the only ones that will be open. So all students will have to go through the ones that are open.
Okay.
And then if a student goes, because I don't want to get into specifics about it during the day.
Sure.
But in order, at the beginning of the day, students have to all come through those entrances. And if they ever go to their car, they have to come check back into the front office.
And I guess my question is, would there be some type of alert that would let you know that another door somewhere
Yeah,
is
we have
open
them.
as opposed
We
to?
do. We have
You
them in our systems.
Okay.
Tell us if a door is open or anything like that.
Got you. Great.
Especially in our ones that are monitored that students could get into.
Mm-hmm.
It'll tell us, and I'm talking about our ones that are badged in, it'll tell us if one's inactive or something like that.
Awesome. Other question, I've had several questions regarding the approval of the charter school, Novus. Concerns
Repeat that,
have
the
been
what?
brought to me, excuse me?
the what? I didn't understand.
Charter school approval. The concerns have been brought to me is, I guess, with you are representing public schools, why are you approving charter schools? Why not just let the state approve them?
My job is to support the will of the majority of the school board, and the will of the majority of the school board was to approve it. So,
That's a question that came to me. And then also, can you discuss changes relative to the funding mechanism for charter schools, if any?
yeah, right now, all state funding, so one of the changes that was put into law this year, instead of finance department here having to write a check for the state and the local portion on the 20th of every month, the state portion will now go directly to charter schools. The finance department will still have to send the local portion. So they'll still have to send that part.
So what does that look like as far as real dollars?
For the local portion, I got our numbers today, it's $4 million roughly on the local portion.
And that would be for all
For
of
those
the,
three, yes.
okay.
Yeah, not including Novus, the new one.
And then this is, this at this point is on actual numbers, or are we still looking at projections on their part?
You are looking at actual numbers for students they had last year, is how they're generating funds. But any new grade that a charter school is adding, they do get funded for projections on that, but it's a much lower number. So for two of ours, I know that they added a grade level between 25 and 50 students. And so they will get funded for those projections of just the new students in those grade levels.
And those projections, we still just pay the local portion?
And the state portion, we really pay both. The state portion is withheld from our TISA funding. So we had some transfers back in May and June into different accounts that the commission approved, that whether it is withholding from TISA that the comptroller asked us to put in. So it's the state funding that is sent to Rutherford County, but now instead of coming to us first and the finance department here at the courthouse having to be a pass-through, perfect word, the state part's going to go straight to charter schools. The local portion will still have to be paid from the finance department. And that's all, Brent. I literally got the memo today. So that is what's best off my brain of understanding it today,
And it's about $4 million.
from the local portion over 4.
And then the projection, what about that projected
was including
piece?
in the projection.
That's included in
The
projections.
projection's about $1 million.
Okay, all right. Thank you.
I have a quick question. Which two schools are increasing their grade?
Springs and American Class School are both adding a grade.
Okay. And then also I have another quick question.
And then Rutherford Collegiate Prep is as well underneath the Tennessee Charter Commission.
Okay. And then also I have a quick question. In regards, I know like, for instance, one of the middle schools that I follow put out something regarding new changes regarding cell phones.
Cell
Is that
phones, yes.
district-wide? Because
It is.
I saw the one that said they're going to be powered off at 7:45 and they have to keep them in a Ziploc. So I'm just trying to, because I've
Yeah.
had questions.
No, it is. It was a state law passed last year that was, if not unanimous, everything, but I think one person voted for a ban on cell phones during the instructional time. And so for instructional time, we are saying students can have them until they get to us, because a lot of parents want to check on their kid to make sure they, got to school, all those different types of things. But once they are going to their first class, let's just say school starts at 8:15, once they are moving out of the cafeteria auditorium, wherever they are at 8 o'clock, then they don't have to power them off. They just have to be away. We don't need to see them. And then from that standpoint, if they leave them on and they go off, then it's a violation of what our code of conduct is. And so that is, the code of conduct is district-wide. Most of our grade bands are doing similar things as far as consequences, but state law gives every school principal the autonomy to have their own code of conduct to uphold safety and security in their building. And so basically within our code of conduct, that's our district policy, as long as they follow that, they're fine. We're not going to be taking cell phones because we don't, one of the caveats in that law, it talks about students have to have access to it during an emergency. Well, if we take the phone, then during an emergency, kids are going to want their phone, and that's not what our focus needs to be. So they'll be disciplined like other things, like being disrespectful, class disruption, those different things.
Thank you.
Yep.
Mr.
We'll be
Wilson.
hearing about it all over the state.
Can you hear me? Sorry. Do you want to hear me? Couple questions.
That's two different questions.
And they're kind of related at the same thing. One, when can we expect the updated 5-year plan? And on that 5-year plan will be a couple things. One, an update on the possible Lee Road property.
Yes.
Secondly, I know with the 5-year plan, you're discussing what the next school move would be. What can you offer, if anything, on those subjects for us today?
Yeah, the new 5-year plan, we will have a draft of it that we'll discuss in August. Part of it is going to change based on, we have worked with RSP, our vendor, the last couple years to do our enrollment analysis. They wait until, and we've asked them to wait until October 1st to do that because we have so much fluidity in and out of our district, within our district, to do enrollment numbers. So we'll have an idea of discussing it in August, but it won't be finalized till October. So, but it should be a lot less than it has been. So the commission has supported us greatly. It was almost $800 million. When I was just putting rough numbers to it, it'll be below 400 for the next 5 years. So that's progress, a lot of progress.
And we have something to show for it now.
We sure do, yes, we sure do. 4 high school additions, a renovation, a complete rebuild of parts of that, a new elementary school. I don't mind admitting it, I told this to our principals last week, we have moved so quick that I went out to Poplar Hill Elementary School on July 3rd. And when I was looking at the building to see what kind of progress we were making, I called Trey Lee, and luckily he didn't answer because I would have felt not very intelligent with the question I was about to ask him, but now I'm admitting it. And so I could not figure out what the building was going up behind it. I was like, is that another public safety building that I didn't know about? What is going on here? Do we have another one? And I was like, oh, that's the middle school, because it is, it is moving. I did not expect it to already be putting blocks up that quick. I mean, it's moving quick. When our team said, no, we got it approved, I think in May, and we'll have it ready to go in August, I guess I underestimated how quickly the bricks would start. So it's moving.
I have an additional question. I'm curious if you can give us a transportation update.
Yes, we have 2 routes that are unfilled right now. And so we are working with our priority list right now to try to assign those 2 routes. So much better shape. Appreciate our contractors, our transportation team, you all, everybody working together to make that happen.
Yeah, that's
Yep.
progress in the last few weeks to get those, because there were 10 last time I heard, so that's good.
Yep, down to 2.
Are there usually a couple that are unfilled? Is that a common problem?
We usually have more than that by this time, so this is better than we normally are. So, and that number will shift because once we know where students have moved to over the summer, who showed up, who registered, we may have to add routes, subtract routes, do all that kind of stuff during the month of August.
Anything else you'd like to share? All right. Well, thank you for
Of course.
coming. I know you've got a busy season coming, and we definitely wanted an update before we got back into it, so thank you.
Thank you all.
Next item, we have Ms. Kristen Swann here, Vice Chairman Wilson, and she has spoken recently, and we met Mrs. Swanson at United Way 3 years ago, perhaps. I think all of y'all were here. You and I were there. So welcome back, and thank you. And I'm glad we had a good time in our schedule to get this update. So.
I wanted to bring these to you guys
And-
because we have updated information.
And be sure and introduce yourself and your position, Kristen, when you. Thank you. I'm going to give one to Rachel, too.
All right. I am Kristen Swann. I'm the president and CEO of the United Way of South Central Tennessee. And like I said, the United for Alice is a study that the state of Tennessee has been participating in since, I think, 2018. This is a study that came out of the United Way of Northern New Jersey. There's an economist there that started this project and really noticed and learned that there was a gap of people between the federal poverty line and the true cost of living. So the federal poverty line has not changed since the 1970s. It is the same no matter where you live. So if you live in Woodbury or Los Angeles, California, it's the exact same. And so it doesn't account for cost of living. So this study looks at 2 data sets, the cost of living index, and it looks at census data to look at how much people earn and then what the actual cost of living in that area is. And it compares those 2 data sets. And so this new study came out. What you have in front of you is for the entire state. I'm going to give you some Rutherford County numbers today. I am happy to report that Rutherford County's number of those at Alice or below has decreased by a couple of percentage points. I can't remember off the top of my head how many, but that is exciting for sure. So do I just do this to make it go?
Rachel, do you know how this
Yep,
Swann?
that's it.
Okay.
Perfect.
You know more than we do.
Yeah. So like I said, are you guys going to be able to hear me if I turn my head? Okay, just want to make sure. So like I said, the federal poverty line has not changed. You can see that this was based on 2 different things, the Household Food Consumption Survey and the 1961 Economy Food Plan. And at this time, families spent about 1/3 of their income on food. And so that's kind of how they came up with this, right? So they multiplied that number by 3 to determine the federal poverty line. Well, that has certainly changed a lot since that number came about. Some of the impacts are this number is used to determine lots of federal assistance, so SNAP, which is food stamps, Medicaid, TennCare, all of that stuff, Head Start, child care vouchers, all those things. The federal poverty line is what is used across the country to determine eligibility. So what we know about Alice is a lot of times they do not qualify for assistance, but they are not making enough to live in our community. And Dr. Sullivan was talking about McKinney-Vento earlier. A lot of times what we see in families that are in Alice is they truly are on the bubble because they are not making enough to survive. They are certainly not making enough to save. And so when one crisis happens, they are very much moving in and out of poverty. And so, we see a lot of students and families who are experiencing homelessness because of their instability. So ALICE stands for Asset Limited, Income Constrained, and Employed. I think the employed part is one of the most important parts to focus on. As these are folks that are working really hard in our community. They are earning money, but they just still aren't able to keep up with the true cost of living. So in Tennessee, two out of three every personal care aides are ALICE. Roughly 1 in 6 elementary and middle school teachers are ALICE. Nearly half of all waiters and waitresses are ALICE. 1 in 10 registered nurses are ALICE. 1 in 4 drivers and sales workers and truck drivers are ALICE. And over half of all cashiers and cooks are ALICE. You guys may know that we expanded our coverage area, so I'm not going to tell you about the other counties because you probably don't care about them. We're in Rutherford. That's what we care about, right? But in Rutherford County, we are at 35% ALICE and 8% federal poverty line. So that makes up, 43% at the ALICE threshold or below. And so, again, like I said, that group of people is very transient in the sense that living in ALICE very much means that you are very unstable. And so one crisis can really, lead to homelessness in a matter of months often. 57,725 households in Rutherford County are below the ALICE threshold. You can see that there is a disparity here, and I cannot read that if I'm being totally honest. But typically we do see families of color do experience ALICE at a higher, disproportionate numbers than white families. And this is also something we really tend to look at. Single female-headed households with children make up 89%. 89% of those families are below the ALICE threshold. So I know at United Way, I've been with United Way for 11 years now, almost 11 years. And we see a lot of single moms, come through our doors because it's just really, really hard for them to make it. So that's a lot of the folks that we see. We've also seen a rise, though, and I think a lot of our service providers here in this community will tell you this. We've seen a rise in seniors of 65 or over that are having trouble on a fixed income living in Rutherford County because of the expense. I think I went the wrong direction. There we go. District 17 in Murfreesboro, so MTSU north to Las Casas Pike, is 69% ALICE or below, so you can see that dark blue in the middle. And then downtown Murfreesboro, where we are right now, Smyrna and Laverne are 53 to 59%. And so those are the highest percentages of ALICE that we have in the county, so downtown Murfreesboro and then Smyrna and Laverne. What am I doing, y'all? Here we go. Wrong way. Promise I know how to use one of these.
It's not you. I've seen that give people trouble.
Okay, here we go. Here we go. That was it. Okay. So kind of what Dr. Sullivan was talking about earlier. So we have 52,643 children that are living in ALICE in Rutherford County. A little bit about the survival budget. And so one of the things that I think is neat about the new data that's come out is there's two different things you can look at. In the study, you can find the website where you can break down the numbers by different, I think it has congressional districts, it has school districts, all kinds of different data. But you can also see the survival versus the stability budget. And the stability budget does take into account things like savings, right? But this is the survival budget, and we always like to show the cost of 2 adults and 2 children in childcare, because childcare is often the second most, if not the highest expense that families have. And so in Rutherford County, for 2 adults and 2 children in childcare, it's $96,216 a year is what it costs to survive here, right? So that's not taking into account saving for emergencies. And for 1 adult and 1 child, it's $56,772 is how much it costs to survive in Rutherford County. A couple of things just to think about, because I think sometimes we see these numbers and it sounds terrible, and we can probably imagine someone that's Alice, and we can probably think, oh, this is affecting a lot of people. But there are kind of unintended consequences of poverty that I think we don't necessarily think about. If you've ever heard someone say it costs a lot to be poor, that's because there's a lot of unintended consequences that I think we often don't think about. So example for housing, you have to have housing, right? And so a lot of times people are paying 30% of your take-home pay, a monthly take-home pay is considered, healthy, financially healthy to pay for housing. And if you're paying more than that, you're income constrained. And so they're living in less desirable locations and substandard housing because that's what they can afford. And they're also borrowing at higher rates, right? Because of their credit scores or their history. What do families do when they can't afford food? They have to cut back on their food spending. We have, folks that their children are not able to eat or eat less in the summer because they aren't able to eat at school. They seek food assistance, or they have to put aside other needs. One of the things that we hear a lot is, well, I can't take that medication, I have to buy food, right? And so they're going to choose that before they choose something else. Childcare, a lot of times they're going to seek less costly childcare, which may not be as safe or may not be licensed or may not be as high quality, may not have, as much educational impact. And then they're going to pay more, they're going to end up paying more, is exactly like housing, or they're going to find alternate means of childcare. So one of the things that we hear a lot is we're staying with a relative. Right, which is amazing. I mean, we love if you have a relative that can take care of your child, that's incredible. But think about someone who's living in generational poverty. Likely that relative knows what they know, right? So we're just, keeping that cycle going. Again, with transportation, we're giving up essential needs to forego savings, buying a lower cost vehicle, delay or avoid payments using public transportation. Oftentimes, if you have a lower credit score, your car will end up costing you more because of the interest rate. All of these things. Technology, here's an interesting one that I think a lot of people don't think about. So a lot of folks that live in Alice, studies show their primary technology is their cell phone. And I'm not sure, I haven't applied for a job in a while, but if you've ever tried to apply for a job on a cell phone, I can't imagine it's very easy, right? And so if that's your only access to the internet is your cell phone, it makes doing things like filling out applications, filling out job applications, accessing, things for your children for school, it makes it really difficult. So some of the economic well-being measures for Alice are work, housing, community, and gaps within the community. So I would really encourage you guys, if you have some time to spend with this data, to look at your districts and look at where you live in Rutherford County, just to see where the gaps are. It is really interesting just to see the disparities. I know Laverne, are you Laverne? Childcare is a big issue there as far as availability, not existing, basically. And so just, really just spending some time and seeing what these are kind of the things that that are measured, that well-being is measured in the community, right? And so just kind of seeing what those look like. You guys have any questions for me? I know that was a lot. Yes, sir.
So where do we go to find where our district is in Alice?
So you will go to unitedforalice.org, and then there is a drop-down that says State Reports. You're going to find Tennessee. Is that it here? Yes, sir, it should be. So Tennessee, and then you can find Rutherford County. And I can't remember if it's congressional districts. I feel like it's probably congressional, but you could do zip codes if you know kind of about where you are. But there's a lot of really good information for you guys on there.
And how is United Way contributing to this solution, or to at least to help?
Yeah. So we have a number of programs. One is our Launch Point program, which is an 18-month program where we walk with families to help kind of stop their crisis, right? So help them not get evicted, help them not start that downward spiral. Because the other thing is, once someone gets into crisis and they kind of start that downward spiral into, okay, now I'm evicted, it's so much more expensive to intervene at that point. So we kind of stop the crisis, then we have coaches that walk with them that help get them financial coaching. They help connect them to other resources. They help connect them to, we have some great success stories of folks going back to the TCAT to get their certifications, to get better paying jobs, just, increasing their savings, increasing their credit score, just because they have someone that's their advocate and kind of teach them, what to do. It's a lot, especially when you're living in crisis. It's very hard to think about the future, right? People are living in crisis are thinking about right now. They're not thinking about 2 years from now. We also have 211, which I would really encourage you guys to know about as commissioners if you ever have people that ask you for help. In my opinion, it's the most robust resource that we have that has a full listing of resources. So they can call 211. You can also text, and I can't remember the numbers. I need to bring y'all some cards. I should have done that. I'm sorry. But I would just recommend calling. It's in English and in Spanish. And so they just tell the operator what they need, and they will direct them to services within, where they live. And then our VITA program in Rutherford County, really it serves folks that are earning $80,000 or less, which is certainly Alice. And this past year we put back into the community over $3.2 million in refunds, as well as savings in, tax filing fees. So that's a great program as well. So we do all kinds of stuff.
How are y'all funded? And the second part of that is, the county has contributed generally. Do we continue? Just curious. I just don't recall this last year's budget.
Yeah, absolutely. I would have to look back. I'm not sure that we are currently getting funding from the county's budget. The Rutherford County employees do a campaign for United Way. So we're privately funded. We have employees that give to us through their employer, through different campaigns that are run. We also have grant funding from the state. Our VITA program, for example, is grant funded. So we're kind of a public-private mix of funding. So
y'all can intervene. You have people available if you're called. Are you staffed sufficiently to take the calls? Are you overwhelmed? Or the people who don't get assistance when they call, is there a sense of scale? Are you scaled up for it? Or?
Yeah, so 211 is a Middle Tennessee effort, and so it is localized in the sense that the directory is local agencies, so they can go in and put in all their information. So we pay a fee to be a part of that service. I had a young woman a couple weeks ago that came to the office. She didn't speak English, and she was trying to communicate with me through a translator app. And so I just had her call 211. I sat right next to her. I had her call 211. She spoke to the woman in Spanish. She gave her all these different resources, and she said, "Thank you so much." She gave me all these places I can call, and she was able to leave. So yes, I do think it's staffed sufficiently. I do think the flip side of like the Launch Point program, for example, because that intervention is so much more intense, right? I mean, it's a long-term, and that's really what people have to have, right? They have to have a long-term help. It can't, this one time, here's $200 is not gonna get someone where they need to be. And so our Launch Point program certainly could use more funding always. We have 2 coaches right now. We served about 56 families last year. And so we would love to serve more. If we had more funds, we could do that. So, any other questions?
I have a couple quick questions. I noticed you stated that you had 57,000 households in Rutherford County that are below the Alice threshold. How many households are there kind of total, do you know, out of the 50?
I think 300 and something. Does that sound right?
I think that's
Just the
300.
percentage of, yeah. Mhm. Does that sound right?
I think 300 issues.
That is a number that came out of the study. So if you go to the Alice website, there is another study they did that is specifically focused on children living in Alice. So because they're using census data, they know the age of the children in the households. So they're able to extrapolate that data. So you can look at the focus on the children specifically. So that's really interesting to look at, is that we know that many children are living in the Alice population in Rutherford County. Mm-hmm. Mm-hmm. Yeah.
Hi, Kristen.
Hi.
How can the average person help? Someone's watching this meeting tonight, or someone shares it on social media, or they talk with one of us.
Mm-hmm.
They may have a day. Like, what can an average person do? How can they volunteer? How can they get involved, even if it's for a day? What opportunities do they have to help you?
Yeah. Selfishly, they can give to United Way. Obviously, I wouldn't be doing my job if I didn't say that. We also have a website called Volunteer Connect, so UnitedWayVolunteer.org. Your wife helped us a lot with that here recently. So we have over 70 local agencies that are signed up on there. So if you want to volunteer and you have a heart for helping those who are experiencing homelessness, you can find an agency that serves that population, and you can go on there and find opportunities to serve. If you're in Laverne or Smyrna, you can find opportunities in that area. So that's another great way. It's UnitedWayVolunteer.org. You can also navigate there from our website. And then I always tell people, advocate. Tell people about Alice. Tell people, there is a lot of misconception, I think, in my personal opinion, that if people just got a better job, or if they just worked harder, they'd be fine. And sure, that certainly may be the case in some situations, but it's not always the case. And I think just advocating and telling people about this data, that it really, truly is a large amount of people, it's our neighbors, it's people that we work with, and they're struggling. They're really struggling, and they want to do better. They want to have a good life. They want to have a stable life. They don't want to struggle. And so, honestly, that would be my biggest ask, is just to tell somebody, that I learned this information. You can read about it online. I just think there's a lot of misconception about it.
So, Kristen, who are you presenting this to? How
I will
how
tell
often are
anybody
you
who will
presenting
listen.
this information, and to what bodies are you presenting this information to?
I will talk to anybody that will listen to me. So you tell me who to talk to, and I will tell them.
So it's not like you have a target. You just wait for a request. Is that what you're saying?
Yeah, I'm going to Rotary in Smyrna in a few weeks. I think I'm doing morning Rotary. There's several Rotaries. We share it with our agencies. They're very well versed on this. I'm trying to think where else I've shared it. Our board obviously is aware of this information.
Do y'all have a day on the Hill or anything like that?
We do. So we have shared this information with all of our local or our state representatives and senators. And because we cover a 7-county region, we've shared it with all of those folks. So yes, they are aware. But I am open to ideas. If you have a group, yeah.
Like you just said, and I've lost my microphone. But like you just said, a lot of people think, oh, they just need to go to work. Well, heck, they are at work.
Mm-hmm.
You know what I mean? It's just the needs are not being met.
Yeah.
And so I think those people need to be, I'll say loosely, our friends at the state and federal level need to be educated.
I agree.
To understand.
Yep.
The crisis that we're in, if they care at
Yeah.
all.
Well, last year, I will tell you, last year, for the first time, we made an attempt to get into the governor's budget. We weren't successful, but I was able to speak to Commissioner Bryson, and I shared this data with him and just said, this is who we're trying to serve. We are trying to, because the other thing that I think people don't realize is that our programs and the things that we're looking at are helping people move off of government assistance. Because what happens is, like we talked about, there's a gap. So you have the federal poverty line, you qualify for benefits, and then you earn $50 more a month, and you lose $800 in food stamps. So to the average person, it could look like, well, I don't want to make more, I don't want to work harder, I don't want to make more money. No, they don't, because they're going to lose, it's a $750 loss because they're earning $50 more. And so the benefit cliff is what it's called, and our Launch Point program helps people get over that cliff, right, by helping with direct support and then coaching them through, all right, we know this is coming, how are we going to save, how are we going to prepare? Because for a lot of people, it hits them, right, like it's in their paycheck and then that benefit ends. And so I think just educating people about that and about these services, that we have to have an off-ramp, right? If we want people to not be on this assistance, we have to have an off-ramp. It can't just be a faucet that we turn off. And so I think just educating people about that, like I said, I will talk to anybody, listen to me. I have talked to them. I have not spoken to city council. They're on my list. But yeah.
It is very frustrating. I will say it's very frustrating. That was one of the things on my list. Thanks. That was one of the things on my list when we got in these seats, was to speak to people, and people that are above us that can help in these decisions. Because one of the things that I noticed volunteering my time at the senior center is that we took a poll, and the largest amount of food stamps that any one of them got was $45. What can you buy for $45 when you're already on Social Security in a very tight budget? And I had some conversations, and it's interesting to see the shock on the faces of the people that are higher than us in those positions that could potentially change it, but it has yet to be changed. Yeah. So it's heartbreaking to find out that some of these seniors are living off of cat food, and trying to find places to get their medicine. There's just not enough for food, not enough for medicine. And I absolutely am behind you pushing this wherever we can get it to.
Well, thank you.
And I thank you.
Yeah, absolutely. Thank you.
I thank you as well, because this is vital information. It's one of the reasons why I asked the question about whatever community, because it is going to impact everyone. While certain persons think it's going to only affect certain segments of the population, it's going to affect everyone. Because when the hammer comes down, it's going to, everybody's pocket's going to be hit. And so this is definitely information that we need, and we need to continue to shout it out.
Absolutely. And they update this every 2 years, so it is a little bit behind because the census is obviously a little bit behind. So anytime I get new information, that's why I wanted to come visit, just to give you guys an update. I'm happy to share, and just, if you ever need me, I just want to be a resource for data and just information that we have. We have a lot of data too about local needs. So our 211 line, we have data about what people are calling about and what the biggest needs are by zip code and things like that. So if you're interested in that information about your district, it's all, it's food, rent, utilities, it's all the things you think about. But I do think it's interesting because it is a local, you can see the local, what people are asking for help, and that, I think that's good information for y'all to have. So.
And I have one final quick question.
Okay.
I noticed you stated that it's a 7-county region. I've received this question numerous times, and I've kind of followed up with some of your staff. In regards to if someone wants to give, if they want to give, but they see other counties attached to, I've gotten the question, how do I know that my dollar is going to stay here in Rutherford County instead of going to Cannon, Bedford, and things like that?
Yeah.
How do you all address that? Because some people, when they, give to organizations, they want it to stay within their county or this, or the city. So how do you all distinguish if I gave you all $5,000 and I wanted it to stay here in Rutherford County, how did I make sure it'll stay here instead of?
You can designate to any county, you can designate to any 501c3 agency, and so we ensure that that money stays where you want it to stay. The other thing too, though, that I think is important to remember and think about is a lot of our Rutherford County agencies are serving regionally. And so I think it's just something to keep in mind, right? Like domestic violence, they also serve Cannon. The Child Advocacy Center, just because we are surrounded by some rural areas. And so I just say that to say, just keeping that in mind, that because Rutherford is kind of the bigger county with these contiguous counties, right? A lot of times that is what's happening. But if you say, I want my money to stay in Rutherford County, it's staying in Rutherford County. And then we have a local committee of volunteers who is making those funding decisions. I don't make any funding decisions. Our staff doesn't make any funding decisions. Those volunteers make those decisions. And for Rutherford County, right now, all of those volunteers are from Rutherford County. Yeah, and we have volunteers from the other counties that decide for those counties because that makes sense, right? They live there, they know the needs, they should make those decisions. Yeah.
Yes, thank you. And Phil, or Commissioner Wilson, thank you also for keeping us in touch with this. And I know if anybody wants to meet with Ms. Swann, her doors are open. If you have a group that you're involved with, and I'm sure she would entertain that group coming down to her office like we did the first time we met. It was a very hospitable place. So, but thank you for your time. And
thank y'all. I appreciate it.
that concludes our agenda. If there's no other business, I will entertain a motion for adjournment. We're adjourned.